going to talk about unexplained infertility from a Chinese medicine perspective. And just to kind of spoil it right away, in doing so, I'm going to talk about why unexplained infertility is not a thing, how to find an explanation, and what to do about it. And for those of you who are new here or might have just stumbled upon this podcast or this video, hi, I'm Katherine. I'm a Chinese medicine practitioner who specializes in fertility with an insanely high success rate. And I've been working in this field for over 8 years now, and I've helped many women get pregnant naturally or through IVF if that's what they choose to do. I don't really think anyone, or a very small portion of women, tiny portion of women actually quote unquote need IVF, but I'm happy to support women in whatever they choose that their journey is that is right for them and their body. And the reason I've been so successful at helping women get pregnant in my practice, whether they have unexplained infertility or just regular infertility, is because I look at the person as a whole. I am never just treating a symptom or a thing, I am treating a person. And I look at the mind the same way a therapist would, and I look at the body almost the same way a doctor would, but in a slightly different lens. But then I combine the two because the mind and the body are never separated. They never have been, and they never will be. And when we look at medicine fragmented like that, like the mind is separate and the body is separate, we're never treating the whole. And it's so important when we're working with fertility, women's health, or anything else to be treating the whole. So to dive in, first, I think we need to define what unexplained infertility is, because if I'm being honest, I'm a little confused about it these days also, because I now have women coming to me telling me, I have fibroids, but my doctor tells me I have unexplained infertility, or I have PCOS, but my doctor tells me I have unexplained infertility, or my basal body temperature doesn't rise above 97 degrees in the luteal phase, but I have unexplained infertility. And in these cases, there's nothing unexplained to me. I think the unexplained part, unexplained infertility is now a phrase that is used by doctors, medical professionals who feel like they can't do anything about it. And so when they can't help you, instead they just label unexplained, right? So maybe you have fibroids and they don't know what to do about it, or it's not in a place where they can remove it, or they feel like the fibroids aren't impacting your fertility based on the location of the fibroids. That may be true. It doesn't mean there's no explanation, because whatever is the imbalance and the root cause causing those fibroids is also going to play a part in your infertility. So there's nothing unexplained. There's something going on that needs to be looked into. And same with really anything else that's going on in your health, in your body. I think the traditional definition of unexplained infertility is things that can't be found on a lab test, right? You get all of your lab work back and everything is quote unquote perfect, and you're still having trouble getting pregnant. But it's important to understand that we can't see everything on a lab test. I mean, to start off, we can just talk about the fact that lab test ranges, they're usually wide, right? It could be, between two numbers, right? Let's just pick a number between like 5 and 20, right? And maybe your actual ideal number is 18, but you don't know that because there's a range, right? Everybody and every person is different. But besides that, there's a lot of things we cannot see on a lab test. And if you've been told you have unexplained infertility, these are the things that you need to look at. You need to look at what is going on in your mind and body as a whole, right? Not just looking at your lab test, your estrogen, your progesterone, your LH, your FSH, your AMH, not just looking at the numbers, but what's going on in you, in your body. Do you have chronic constipation? Do you have gas? Do you have bloating? Do you have headaches? Do you have migraines? Do you have painful periods? Do you have short periods? Do you have light periods? Do you have long cycles, short cycles? The list goes on, right? Do you have back pain? Do you have knee pain? Do you have hip pain, right? Anything that's going on in your body is going to play a part in your fertility. Because all of these signs and symptoms that your body is showing you is a sign that something is out of balance. And every system and every organ in our body is connected. It might not seem obvious to you that something like migraines would be connected to your fertility, but it is. And I'm going to paint the picture pretty simply here to kind of understand this, but migraines are a form of a deficiency in your body, right? Your body's lacking the resources it needs to keep your body healthy, and that ends up not getting enough blood flow and not getting enough movement to your head, and that's what's causing migraines. Well, that same deficiency of resources is going to make it really hard for your body to have the energy and resources to maintain a baby. And another aspect that's often widely overlooked is the relationship of our digestive system to our fertility. our digestive system is the foundation of our health. It's not everything, but it is the foundation. If the food that we're eating, we're not able to absorb and assimilate and then use that food to create the resources in our body, such as sex hormones and blood and energy, to be able to maintain a healthy menstrual cycle and get pregnant, then nothing else matters, right? The food that you put in your body does not matter if your body cannot digest it. And I think we often underlook the importance of what our digestive system is telling us to our fertility. So if you have constipation, if you're not having a bowel movement every day, or you're having more than 3 bowel movements a day, or you have loose bowel movements, or you have really hard stools, or you have cramping after eating, or bloating, or gas, these are all very clear signs of what you need to work on. And there's nothing unexplained about your infertility. And it's not just our physical health that plays a part in our fertility, it's our emotional and mental health as well. Stress, worry, fear, anxiety, suppressing any emotion is going to deplete those resources that your body needs to get pregnant and maintain a healthy pregnancy, and it's going to make it really hard for you to get pregnant. Now, I have a whole episode on this podcast explaining how stress and anxiety and worry and fear and emotions affect your fertility. So I highly recommend checking that out if you want to learn more about this aspect of fertility. And that's episode number 18 if you want to dive deeper into how stress and anxiety and all of that is affecting your fertility. Today, I just want to put it real simply. If we're stressed, our body is in a state of fight, flight, or freeze. That causes our body to release hormones such as adrenaline and cortisol. Now, a few ways to think about this. One, when our body is in a state of fight, flight, or freeze, and we're releasing adrenaline and cortisol, it is slowing our digestive system. When we are in that stressed out state, our digestive system is slowed down. It's put on pause because that's no longer the priority, right? If you were running away from a tiger, which, is the common picture people will talk about when they explain fight, flight, or freeze, and the purpose that we have it built into our human bodies, into our structure, is to save us, right? Fight, flight, or freeze we've had since humans were born, and the purpose of it was to save us from a tiger in the woods, whatever it might be, a tiger in the jungle. When you are running away from a tiger, your digestion is not important. What's important is that you can run fast, that you can breathe quickly, right? That's what's important. So your body is going to focus on that and slow down everything else. It slows down your ability to make quick decisions. It slows down your digestive system. But I want to focus on the digestive system part here because, again, that's the foundation and basis of fertility and health, is our body to be able to digest food. So often what happens is we get into this state of fight, flight, or freeze, and we get stuck there. And then we go to eat, and our body's not able to digest that food because we are stuck in this state of fight, flight, or freeze. Now, another way to look at it, and there's so many, I could explain this in probably 100 different ways, but another way to look at it is that our stress hormones and our sex hormones come from the same energy resource, right? So our adrenaline and cortisol and our estrogen and progesterone, they come from the same bucket of resources. So when we're constantly depleting that bucket of resources by releasing adrenaline and releasing cortisol, then we don't have enough left for those sex hormones, for estrogen and progesterone, to maintain a healthy menstrual cycle and to help your body get pregnant. And I think medical professionals and women themselves often really underestimate the impact that our thoughts, our emotions, and our lifestyle and our stress plays on our fertility and our bodies. And it does. It's a huge aspect of it. Huge. A lot of the times when I have women coming to me with unexplained infertility, we take a look at their diet. Diet's not usually that bad, right? Either they've listened to me or they've listened to someone else and they've already made changes to their diet for a while and it's still not working. They're still not getting pregnant. And the reason most often is because they're stressed out as fuck, right? They are still in this stressed out state and they're not bringing their energy back down. But you can do all the diet things. If you're stressed out, if you're anxious all the time, if you're worried or living in a state of fear, it's not going to make an effing difference. We need to focus on our mental health as much as we do our physical health. And I'll tell you, most people tend to turn towards food and that physical aspect of it because it's easier, right? I get that. It's so much easier to cook a good meal than to look at years of trauma in your life, but we have to do it. Now, the how to do it is what I really focus on in my work, in my practice. So when I'm working with patients one-on-one, that's what I'm taking you through, to examine where are those triggers coming from, what's causing that stress and anxiety. I think an important aspect to understand is that your stress or anxiety in the present moment is not actually coming from the present moment. And I know that might seem weird or foreign or even maybe woo to you at first, but it's not. Look, our stress in the present moment is based on our perception of the present moment. And our perception of the present moment is created from past experiences. So when I work with women one-on-one or through my membership, and I in my membership, the Femergy Fertility membership, which is a monthly membership you can join and cancel anytime, I walk you through how to identify these triggers in your life, how to identify where they came from, and then how to rewire that in your body and your mind so that you don't need to constantly be sending your body through the cycle of fight, flight, or freeze, that you will be less triggered. Because to me, the goal is never managing symptoms, it is getting to the root cause and really fixing them. So all of this to say, I don't believe in unexplained infertility. There's no such thing as unexplained infertility. And to be honest, I've never met a woman that I could not explain her infertility in 1 hour, right? It's the patient telling me, you know what is causing your infertility. You just haven't been asked the right questions or you haven't looked at it the right way. And that's what I do in my practice. And that's what I also walk women through how to do in my membership. If you want to start explaining your unexplained infertility, you need to look at your mind, body, and soul as a whole and start examining every aspect of it. And this can be challenging sometimes because a lot of times we're not taught what is normal and what is not normal. And we often tend to believe that things that are common are normal, right? Like being stressed out at work is quote unquote normal. It's not. I'm not stressed out at work. I love my job. There's things that annoy me about it sometimes, but I'm not stressed out on a day-to-day. We're taught it's normal to have painful periods. It's absolutely not. It is common. We're taught that it's normal to have bloating. It's absolutely not. It's common, right? I could list 1,000 things that we're taught is normal, but is not. Skin disorders, they're not normal. It's not normal to have eczema. It's not normal to have cystic acne. It's not normal to have psoriasis or dry, itchy skin. None of this stuff is normal. So when you're trying to explain your unexplained infertility, you need to look at your mind, body, and soul as whole because everything is connected. Your skin is connected to your reproductive system. Your hair is connected to your reproductive system. Everything is connected. So you've been told you have unexplained infertility. And at this point, you realize, or you're starting to realize that there's nothing unexplained about it, but maybe you're still not sure what to do about it, right? And this is what you're going to do about it. You are going to stop seeing the professional that told you you have unexplained infertility because that's their way of telling you they cannot support you and they cannot help you. And you are going to seek support. Now, whether that's through your own journaling, your own reading, your own research, or reaching out to someone such as myself or other practitioners that have experience in this space, you need support. Nobody should have to do this alone. It's really hard to look at yourself objectively. When I have something going on in my body, when I was struggling with infertility, I reached out to someone else. I am my own practitioner. I am my own healer, but I need support to look at my body and my life and really objectively see what's going on. But the first thing you can do to start explaining your unexplained infertility is just listing out every symptom in your body, from big to small, right? Trouble sleeping, a toothache, itchy skin, whatever it might be, writing out anything that's going on in your body that feels uncomfortable. You're starting to think maybe that isn't normal. Maybe that shouldn't be happening. And I don't care your age or anything like that. Anything that feels uncomfortable should not be happening. You know, we often think as we get older that our joints should start to hurt. That is not true. That is because we are losing those resources in our body, specifically yin, which is thick fluids in our body, such as synovial fluid, that make our joints hurt. It's not that it should be happening, it's that it is happening because you're not supporting your body in the right way. So list out all the symptoms that are going on in your body and then start to question why. This is a good step to reach out for support, to help understand why. And that's what I do in my practice one-to-one with patients in person and remotely. I work with women all over the world. And that is a big part of what is ingrained in my membership that I created. And I am so excited to introduce this to you guys. It is new. I launched it a week or two ago, depending on when this podcast comes out. And I walk you through how to examine every aspect of your life, from your mindset, your thoughts, beliefs, your diet, your lifestyle, your exercise, everything, to really help you optimize your fertility and also help discover where there are problems, right? Where is something going wrong? And there's support every step of the way because, again, no one should have to do this alone. So there is a community aspect where you can gain support from other women going through the same thing. And I will also be answering questions in the community because support is important. And there's monthly group calls where you can get one-to-one support in a group setting. But if you take nothing else away from this podcast, I want you to understand that your infertility is not unexplained. You just haven't found the right answers yet. But the answers are there and they can be found. So don't give up. Unexplained infertility does not mean that you need to go to assisted fertility methods. It does not mean that you can't become a mother. It just means that this is your wake-up call, right? This is your sign to start looking at everything that's going on in your body, your mind, your soul, and your life. And as always, if you have questions or you need support, please reach out to me. You can find me on social media at Manhattan Medicine Woman. All the information should be linked in the show notes. So thank you. Thank you for tuning in to Their Chicos. I hope today's episode helped you see the connection between your emotions and physical health a little more clearly. If you enjoyed the show, be sure to subscribe, leave a review, and share it with anyone who could benefit from this conversation. And remember, true healing starts from within. Let's keep exploring that journey together. See you next time.